Excellent.
Excellent.
I can't complain.
For someone who just fractured her hip, Jerry Clark is feeling pretty good. She fell 5 days ago in a coffee shop.
I've made a terrible, terrible noise. I knew something had broken, that's for sure.
Clark underwent hip surgery just a few hours after arriving in hospital, making her one of the lucky ones. A new study has found 2/3 of patients in Ontario don't receive the urgent surgery within 24 hours, and that can have serious consequences. After a hip fracture, 35% of patients die within 1 year.
Because when you're waiting around with a large bone broken, you can get a blood clot, you can get pneumonia, you can have a heart attack. So these are the kinds of things that were happening, and they're not necessarily the result of the fracture, but the result of waiting around.
Canadian guidelines say patients should wait no longer than 48 hours.
This is the neck, this is the head.
The study author says changing that recommendation to 24 could save lives, and this cardiologist agrees.
To a large extent, it tends to be much older patients who don't have a strong voice, so they would typically wait longer.
At 90, Clark received hip surgery in less than 6 hours as part of an international study called Hip Attack. It treats these patients with the same urgency as someone who's had a heart attack, freeing up space and staff in the emergency room.
So we're trying to reverse this and see, okay, what if we actually really treat this like a heart attack or stroke, and we really quickly reverse this? Can we then substantially improve the outcomes? Because the outcomes are terrible.
But Ontario researchers found wait times for hip surgery largely depend on which hospital you go to and how that emergency room and doctors prioritize patients in pain.
I'm very, very grateful that it was done so quickly. Yeah, absolutely.
It may have even saved her life. Christine Birak, CBC News, Hamilton, Ontario.